Good afternoon, everybody. I'd like to call the meeting to order. We do have a quorum. I'd like to acknowledge that we are on the traditional territory of the Lakota people. Can I get a motion to adopt the public agenda, please? And seconder? Motion adopted. We have no petitions and delegations. We have, I'd like to get a motion to adopt the previous minutes, please. And seconder? All in favor? Thank you. Any business arising from previous minutes? Seeing none. I'd like to move on to reports. We have number 1, potential regional housing service opportunities and considerations for to receive. Thank you. Can I get a motion for that?
So moved.
Seconder? Okay, are we going to have a presentation on this or just discussion?
Yes, we do.
Okay.
Do I have a seconder? Did I miss the seconder?
Yes, Second?
I can
No.
second. Are we gonna get to see it? I haven't
It
seen
was,
it.
sorry, I've got to learn names. It was Christy.
Gotcha. Thank you. Sorry.
Sorry, I can see you, like, what is that?
So are we having a presentation on it?
Yes.
Okay.
Oh, boy. Is it up there? It is. It says we're working on it. I'm gonna try to order a different version. Because we're really Thank you for your patience. We did it. Slowly but surely, I'm getting there.
Thank you. Thanks, Betty. Through the chair, this report and associated presentation will speak to a dialogue session held in Campbell River on April 29th, 2024. We held a meeting just to share the good news of the recently established regional housing service. And the purpose was to bring together community housing providers, social service providers, and organizations with related mandates and discuss varying housing service models up and down Vancouver Island. And discuss just how a regional housing service could potentially benefit or create partnerships and initiatives together with like-minded community groups that are already providing housing or hoping to develop it. We made it clear that the newly established housing service directly correlated to the regional board's strategic priorities for the years 2023 and to 2027, which includes community well-being as a priority and outlines diverse and affordable housing as focus areas, along with safe transportation and economic development. And some other examples of this recently happening within the SRD are the Just Like Home project, workforce housing included in that project, active transportation network plans, and establishment of this committee. So this just gives an overview of the attendees on April 29th. We did feel like we had a pretty good regional turnout. We did have Cortez and Discovery Island Affordable Housing Societies come out, and the St. Vincent de Paul Society, which has some land in the community and are looking to develop housing. And we also had different groups that are either operating adjacent services or, working towards more affordable housing in the area. So we started the dialogue session looking at regional housing service models up and down Vancouver Island, specifically that regional districts are supporting financially or with staff. So we started with the Capital Regional District's Housing Corporation, and this is kind of the big brother of housing services on Vancouver Island. It's a wholly owned subsidiary of the Capital Regional District, and their mandate is to develop and manage affordable housing and meet the needs of people in their diverse communities. They are the largest social housing provider in the Capital Region. There's some bylaw language there around what they can do with their housing service, and that includes land banking, which we thought was really interesting because it's really anticipating the needs in the future, being able to purchase land and then develop housing on it years later. It just allows regional districts and municipalities to kind of plan for the future and the needs of the housing and also aging populations. We also looked at the Nanaimo Systems Change Organization. They also are looking at housing in a diverse way, looking at homelessness as well as other needs in the community and taking a systems level approach to bringing together collective voices and seeing where the needs are in the community. They're financially supported by the City of Nanaimo, the First Nation, and also through the federal Reaching Home program. The Cowichan Housing Association is a really robust organization with 3 funding streams. So the bylaw came through the Cowichan Valley Regional District in 2018, and it provides an annual financial contribution to assist with programming as well as these funding streams mentioned. So the 3 streams are the Project Development Fund, which is the pre-construction phase of housing, Rental Housing Capital Contribution Fund, which impacts new housing units and emergency shelters, and 3, the Emergency Contingency Fund, which reacts to sudden loss of supply due to fire and flood. And that kind of shows a relationship too between the Cowichan Regional District's Emergency Services Department and their housing service. I think this is the last one. The Comox Valley Coalition on Homelessness is financially supported by the Comox Valley Regional District. It is a cost of $160,000 per year. That's a 2021 figure. And their work mostly is looking at addressing the unhoused in the community and the sector. In 2022, they collaborated with partners to provide 3 nightly warming centers throughout the region. And yeah, I know that's something we struggle with in our region each year. So through the dialogue, there were some core themes that emerged. Just go back to my notes here. So the 4 themes were enhanced coordination, capital funding support, and recognizing diverse needs, as well as advocacy. For enhanced coordination, organizations express the need for more effective communication between housing operators, funders, and social support organizations. We have some groups in the community that are already doing this work, but we do see a further need for streamlined communication and a core place where data is consolidated with regional housing and homelessness information. We also see a real need to strengthen relationships with developers to impact mixed income housing. Secondly, and this was a theme throughout all the models we looked at, was capital funding support. So this would be able to impact nonprofits and other groups that are working to develop units. And they voice the need for pre-development costs such as roads, water systems, and sewers to be supported as well, because these are sometimes not being able to be funded by provincial and federal programs. Something that really shined in our dialogue was recognizing the diverse needs of the Strathcona region specifically. So we know that in some of the smaller communities, it's harder for them to be eligible for larger funding streams. And so they hope that the SRD's housing service would take a more innovative approach to developing housing, whether that be retrofitting like already built buildings or things like that, just to be able to impact new units in smaller communities has been a challenge. And then lastly, we discussed advocacy. So kind of a common theme throughout was that a lot of the funding models that are put out by federal and provincial funding bodies often don't meet the needs of small and remote communities, and sometimes not even the needs of Campbell River. I did mention the federal Reaching Home Fund. We're not a designated community here, so we are not able to access that money. And that's a recurring fund which comes in and impacts homelessness services and such on a yearly basis. So yeah, we discussed advocacy and trying to get the word out to higher levels of government on what the needs are here in the North Island for the Strathcona Regional District, and also just to give a voice to some of the smaller communities that also have housing challenges. And that's all for me, but I'm happy to take any questions.
Discussion? Go ahead.
Ready to use the mic there, John?
You should be able to use it.
Do I need to use it?
Yes?
Yes.
My question would be, was there clearly plenty of social agencies there, but was there anybody from the SRD board, any municipal government, anyone that actually has control of money?
Not at the first stage. It was really just to hear the needs and challenges in the community. But I think if we were to bring back that same group with a little bit more understanding on the policy development side of our regional housing service and how we plan to utilize it, then I think it'd be really great to have experts in governance experts there to speak to that for sure.
Further discussion? Go ahead.
Is the hope that this committee is sort of going to make recommendations to the board on how to move forward with the housing service? Or are we just trying to get caught up here?
Okay.
Thank you through the chair to the committee. I think the initial thought with respect to this process that we did a couple years ago now, I guess already, was knowing that we had, the SRD had established a housing service. How do we provide considerations or options or recommendations to the board as to how funds that are potentially allocated through that service are then provided through the regional district, and whether or not there would be considerations to supporting initiatives with other providers, whether it was more of an advocacy role or if the board was more supportive of us using those funds to actually provide capital funding for housing needs within the region and building housing. So this really was a direction through senior management and the CAO to try to explore what the needs are in the community with those that are more aware of what those needs are, and bring those back to the board for some thoughts and considerations. Because at this point, all we have is our housing service, but we don't have a bylaw that actually determines how we move forward or where those funds are used. So at that time, it was the health network. So we thought that that would be an appropriate mechanism for the health network to kind of explore and bring that back to the board. Now that we've established a community health and wellness committee, likely some of those recommendations would come through this committee and then further to the board. So this is really to provide information to this committee to catch up to where we were when we didn't have this committee and it was still the health network, because the thought is that there will be a report coming through the regional district to the board to start thinking about how do we actually use this housing service.
Any further questions? Go ahead.
Can you back up the slides back to the one that had all of the attendees?
Nope, you just add it. There we go. Did you have a follow-up?
Yeah. Just trying to remember what their new name is now. River City Inclusion. Were they invited to be at this?
Apologies, I can't recall. There were some regrets to this event.
I'm just looking for different associations that we could partner with to develop housing that would operate them when they were done. And I know River City Inclusion's been doing it for years and would be definitely someone that would be good to partner with.
Go ahead.
Thank you, Chair, and sorry I'm late. The one thing that I noticed when I went through this, and it's, sort of an old comment of mine, is that basically when we talk housing, we end up talking about the operators. But rarely do we do any real discussion with the builders, development community. And, it's been my observation over a lot of years that a lot of the housing that gets built is, government funded, incredibly overpriced because it's government and everybody knows it's government, so the price is going to be 2 or 3 times what the private industry would be able to supply it for. And it just makes sense to me to have, on the board for these discussions, representatives from the development and also the building industry. So that we could look at this a little bit differently, because we always look at it through the lens of I won't say unlimited money, but it's taxpayer money. But it's the government that's handling it. But the prices, like you say, are coming in on all the projects. The standards that they've got to, produce housing for is extremely high standards, which, really prices it. It just doesn't make it reasonable.
Right.
So I think there's different ways of looking at it. And I think it's really important to have the discussions with the industry right from the start.
Thank you. Well, I do have a couple of questions of my own. First of all, when I was looking at our schedule, we don't have very many scheduled meetings for this year. I'm wondering, given what Councillor Kerr and Mayor Dahl have raised, if it would be more appropriate for us to kind of circle back and bring all of those people into the same room and have a big discussion. One thing that would concern me is that, yes, we've started a regional housing service, but does everybody really know what that means? And how does the regional district even use that regional service to do anything? So I think it might be more appropriate, if possible, if we can kind of get a meeting fairly quickly with everybody, do a big presentation, find out what everybody can do. Maybe we can all land on the same page and then start off with something. That's just my thoughts. Thank you. Any further discussion?
Who are all of these people that you want to get together with?
Well, I mean, I would suggest, if you have people in mind, or if there's anybody here that have people in mind that would be more appropriate to have in a meeting, let's reach out and see if we can contact those people. Is there an interest with builders to come to it? Are there builders that are appropriate to approach? Which organizations can help us and help the community get something off and running a lot quicker? So I'm leaving it back to you guys.
The more people you involve, the less you're going to get done. That's all I'll say about
Right,
that.
but I think it could be a very focused, if there's already contacts within this regional district, you can focus that discussion very easy and, make it a productive meeting. It doesn't have to be a long meeting. And, maybe it doesn't need to be an open forum meeting like this, a public meeting. It could be initially start off, with just a small meeting. Go ahead.
You know, when we're talking about housing, we're talking about the whole spectrum. And, you know, I mean, I think it's definitely government's got a place to play in the process in terms of, you know, standards, codes, that sort of thing. You know, all those things that slow down the process and also on the other end, you know, drive up, part of that is because they're slowing it down, drive up the costs of anything. But, you know, when you're looking at the whole spectrum, you know, we're not just looking at, you know, government housing like multifamily housing or, you know, big buildings, you know, but we can be talking about, you know, small subdivisions with smaller homes, fewer amenities, you know, but affordable. You know, there's a lot of thinking outside the box. You know, when we're talking about housing and affordable housing, especially on that end of the spectrum, there's a lot of place for government either to change bylaws or to, you know, at the same time lobby government. And I think the government's really open to obviously having more housing right now, but it's over the whole spectrum. But I concur with what Mayor Dahl said, that I think just getting a meeting together with you know, overlapping, you know, a lot of people there with overlapping comments and views, and that you're just going to slow the whole process down. It's got to be really surgical, strategic, and then you're going to get something out of it. If that's the purpose is just come up with another report, then, you know, load it up. But if the purpose is specific to having certain outcomes, a smaller group's always going to be better.
Yeah. Okay, so then my next question would be then, how do we achieve that? You know, who would you like to see initially to meet with?
I could see benefit from just kind of a few of the big non-market housing providers. A couple representatives of builders or developers, and then a couple representatives sort of from government. I think that you could keep a group quite small and still have a diversity of opinion there, but I think it needs to be a very clear purpose, right? Like, what is this meeting about? Is it to decide what the recommendations should be to the SRD board related to how the bylaw should look for the housing service, or like what's the outcome? Because I think you're going to talk in circles if you don't have a very clear outcome.
Follow up?
You know, I think that we need to have clarity on what we're trying to do. Like at the Capital Regional District, I know for a fact that they had Seymour Pacific build them 3 buildings that they operate. When the buildings were finished being built, they turned the keys over and the CRD bought the 3 buildings off of Seymour. Super simple, super fast, efficient, and cost effective. Seymour can build a building for a third of what BC Housing builds the exact same building for. So is that what we're looking to do? Are we going to develop housing, or are we going to talk about housing? If we're going to talk about housing, then I'd like to know that, because I don't need to be here.
Right.
If we're going to develop housing, then I'm all for it.
I would agree with that.
It comes down to being that simple.
Yeah.
And, you know, we have 3 big developers in Campbell River. For sure, one of them's not interested in doing that kind of a development. Possibly 2 don't feel that local government should be in the real estate market. But reality is, in a lot of cities, the local governments own a lot of real estate. Vancouver, they operate literally thousands of apartments. So if that's going to be what we're trying to do, awesome. But we need to know what it is we're trying to do.
Further comments? Well, I think if we have a housing service, it would be nice to see it being used. And, we're using it right now for the workforce housing, but I mean, that's only, a small portion of what we could be doing. So I wholeheartedly agree that if we have the service, let's see if we can deliver housing.
I'm just curious then, are we leaning, again, this idea of making a recommendation to the SRD board? Because the way that housing services are set up across different regional districts are very different. Some are set up to develop housing, some are set up as actually having their own housing corporations. Some funnel money through nonprofit organizations who then administer funding to develop housing. Like the model is so different. So I guess I'm just trying to catch up to how we would get to the model that we want to use.
Yep. I don't know. I would turn that back to, for further discussion. Right now, when I look at our regional housing service, it's pretty broad in what we can do. I don't think we've restricted ourselves. So, it's a matter of a board decision, what we want to do with it.
Through the chair, if I may, I think that was the purpose of this directive from the CAO was to try to get a committee or a group to spend more time on the topic to then provide those recommendations to the board so that the board was aware as to what different options the regional district could have. And obviously we have a number of options available to us, and we can build housing, but we could also support housing, or we could support housing providers. So it's not limited to just one mechanism, but I think what we really need to do here is do some more of the heavy lifting so that the board can give staff the direction as to where we want to go. So I think it's appropriate for this committee to spend a bit more time on this, to reach out to maybe a number of the participants in the last session, and perhaps some of our building community to come together just to have a better understanding as to what those partnerships could look like, so that the board has a better understanding when we bring this back to them for further consideration. So I support us maybe giving staff some direction to come up with a group and a meeting for us to give this some more thought.
Okay. Do we need that in a motion or?
I'm just curious if it's worthwhile to, because we are talking about having multiple different streams, if we're bringing people together in a meeting, it might be best to be able to present them with what different models look like. And I'm wondering if it's worthwhile doing a little bit of reaching out to, to regional districts that have gone the housing corporation route, and like, what are the pros and cons? What are the challenges they're seeing? What are the successes they're seeing? Like the ones who have not used housing corporations but are funding through a nonprofit or something like that. Like, what are the pros? What are the cons? Like, I don't know. I think presenting the possible models would be a strong way to start a meeting to then build discussion on.
Go ahead.
Through the chair, through my research and conversations with staff that are in other regional districts, what they can tell me about what's on paper with their bylaw that they're obviously following, and the practice in which they, either bring together developers with nonprofits, or how the government communicates with their partners, it does look different, and it's kind of hard to explain without having the experience. So when they come, if they were to come and potentially present on their own model, then we would get a more full scope understanding. Like, for example, the Nanaimo Systems Change organization, even their website, like I kind of struggled to navigate that and understand exactly what their tangible outcomes are. But if they could come and answer questions more to what they're doing to impact housing and affordability, then I think there would be like a stronger takeaway from something like that.
Okay. Go ahead.
Thank you. I think that's a great idea, but maybe to get started, a staff report that actually, sort of showed us the different opportunities and a local group just to, like we were discussing with builders and nonprofits, a small group to look at that, maybe choose from that menu, if you wish, the best one and maybe the second best one, and then get, somebody from that community or has those ideas to come and make a presentation, rather than getting somebody from, some communities which may not be appropriate at all. So just to kind of fine tune it.
Okay, do you have a kind of a proposed motion in mind?
Well, I would ask that, make a motion to ask that staff bring back a staff report, sort of looking at the spectrum of different ways of doing this. And also, with the committee's input, put together a list for a meeting that we could discuss it.
Okay. Can I get a seconder to that? Okay, sorry. Sorry, we need to vote on receipt of the presentation. All in favor of the presentation? Thank you. Now the motion, seconder on the motioner, please. Okay. All in favor? And that carries. Thank you. Moving on to item 2, the Strathcona Community Health Network Strategic Plan for receipt. If I can get a motion on that. And a seconder? Second. Okay, thank you. And is there a presentation on this? Thank you.
Through the chair to the committee. For most of you, this will not be a new item, as we looked at it at the meeting earlier this month, and Stephanie was with us as a Table of Partners member. So I'd like to present to you some of the previous work that the Health Network Table of Partners had completed in regards of their strategic direction. Some background. So in November 2023, the Health Network Table of Partners worked with a consultant in a full-day session to review and formalize a path forward. Then in spring 2024, their strategic plan priorities were finalized by the former Table of Partners. In fall 2024, the regional board passed a resolution to develop a new model for the health network, which is now the Community Health and Wellness Committee, where you are today. And then earlier this month, appointed board members to the committee made minor changes to the strategic plan, and this draft strategic plan has not yet been endorsed by the regional board. So as it currently stands, it has had some minor edits this month, and it will go to the board if it is agreed upon here that we do so. So the mission is to improve the health and well-being of communities in the Strathcona region by focusing on upstream approaches centered on the social determinants of health. The guiding values are to exchange knowledge and build common understanding of the social determinants of health, strengthen relationships and build trust by recognizing common challenges, identifying unique community development issues throughout our region, aligning around common vision to amplify impact on shared priorities, and engaging in collaborative problem solving to encourage innovation and efficiency through priority projects and initiatives. So plainly put, the strategic priorities for 2024 through 2027 are network development. So that includes collaboration, communication, information, and advocacy. 2, relationship building and engagement. And 3, capacity and action on the social determinants of health. And this just outlines some of the priorities and objectives for each strategic priority. Some of this has actually been completed prior to coming to you, but obviously we can make any changes and amendments as needed. So some of those priorities are communication and outreach plan, regional outreach and engagement on a recurring basis, relationship building with First Nations partners, relationship building with the business sector, and increased sharing opportunities between the SRD board and this committee. And some of the objectives are to support the work of the coordinator within the region and community, expand on communications and social media engagement, review our terms of reference where we see fit, and evaluate and expand membership and appointments and update the membership application. That is one thing that has been currently updated but could be reviewed by this group. Relationship building priorities, basically to just have touch points in all of our regional areas and understand who has their finger on the pulse related to, nonprofit organizations, the business sector, economic development needs, and community grassroots groups. Formalizing relationships across sectors, working on different projects where capacity and development are required, where we know that some of our smaller municipalities and electoral areas don't have staff like we do here in Campbell River and in some of the larger municipalities. And thirdly, the capacity and action on complex social issues or the social determinants of health. Priorities are to support regional public policy development and implementation. So this is some of the work we're doing right now, talking about the housing service, support for key regional service development, building capacity and sustainability on initiatives, identifying community needs through data collection, planning and coordinating workshops and education opportunities, pursuing funding opportunities that are in line with the SRD board's priorities, and executing priority projects as determined by this committee and the board. Any questions?
Go ahead.
Thank you, Chair. Thanks for the report. My only comment is this is obviously top down. This is something that comes from government. It's something that comes from VHA. It's a huge brush. I mean, we've got a small committee that's doing some work in the community, and I mean, if our planner was running around doing all this, there'd be no work to do. There'd be no time to do anything, basically. So, I mean, as much as this looks good on paper, and it's, I think, as a policy that, or a strategic plan, I mean, it could be one page and be really focused. It doesn't need all this stuff. That's my thinking. I mean, I think that, if we could decide on some really important game changers in this community, that we could really make things happen. But with a strategic plan that tries to do everything for everybody, and it's, as much as it looks good on paper, it's not going to succeed. Not in the way we want it to succeed.
Further discussion?
I'll just kind of adding to that, I think that strategic plans can kind of be a bit of a umbrella as to what kind of work can fit under them. So I don't know that the strategic plan has to be super specific, but I wonder if it would be a benefit to have a bit of an action plan so that, like you say, we're not going in all directions, so that as long as we're fitting under the umbrella of the strategic plan, but getting them then more focused with the actions, if that's a way to be able to still be nimble in what this committee might do in social determinants of health, which, as you mentioned, is a very broad brush, but then still be able to kind of zero in on some more specific priorities, which might change over time and might need to be adjusted over time based on regional need. I don't know if that makes sense. You know, like homelessness and housing might be a really big focus right now. Let's say we're really successful like in that, and then in 3 years it might be like, oh, you know, the focus needs to shift a little bit to early years development or something like that. This strategic plan would still allow that umbrella for that shift to happen, just as a thought.
Go ahead.
I could share too, just in the last year, we've been able to pivot to do some exciting projects. One that was really eye-opening for me was supporting the TASIS Housing Needs Assessment, which is not something that I normally would have supported in my role, but they, you know, unfortunately didn't have the capacity to take it on in-house, and I think the SRD was able to support them to give them a really great report that outlined their unique challenges, which I think sometimes we don't see in a lot of housing needs reports that kind of give a broad brush of housing and what the needs are. But TASIS as a unique community had unique needs across the spectrum of housing, and I think because of this kind of background, understanding of the social determinants of health, we were able to give them a document that was really able to give a strong illustration of what their needs are.
Further comments? Well, I do have one myself, and that is that when I looked at this strategic plan, it is pretty broad. There's a lot of things there, and I'm wondering more in my mind, what does this committee want to do, considering that we're already almost halfway into this year? You know, what do we want to get done? Also looking at the fact that we're in an election cycle next year.
I mean, in line with what Ron's saying, can we kind of highlight a couple of priority areas maybe for this group to look at over the coming year and a half or something? Like
Yep.
that, maybe. I don't know if that helps narrow it in a bit more.
Okay. So which points do we want to highlight?
Thank you through the chair. Just from what I'm hearing, it seems that we really want to see some action. This is a really good, like you said, umbrella document that shows all of the things that we can do. But given this being a new committee and us trying to revamp the old health network, and some of this work already having been done through the previous structure with respect to network development and those sorts of things, although more work could still be done. I'm hearing that we really do want to see some more action-oriented type initiatives and projects. So perhaps what staff can do is, just with the discussion that's happening here today, bring back a report that highlights those areas within this document that would work towards what you had said, Stephanie, as an action plan. And then this committee can support the action plan, which then gives more direction to staff in between our meetings to then come back with those sorts of projects and initiatives that might provide us more tangible outcomes, which is what I'm kind of hearing from the rest of the committee.
Okay. And go ahead, Councillor Kerr.
Thank you. Yeah, two things that, pop up to me, obviously housing, and that's across the spectrum. So, and in terms of, it's nice that we help TASIS move ahead, but, there's a huge population in larger centers that it's just not happening. The other thing, that I'd really like to see a focus on is recovery facilities. And we need that in this community. and both in terms of lobbying for it, and but also in terms of getting it built. And like I say, in terms of facilities, second stage housing goes right along with that. So that sort of crosses over with your housing. And, you know, I mean, one of the problems with all of these isn't just operational, it's the cost of getting the buildings built. And so that goes back again to some of our housing challenges, is how do we get these facilities, how do we get these houses, homes, whatever built at a lower cost to make it more manageable. But to me, those two things would be, I mean, I think in terms of game changers in this community, would be top of the list. And, you know, Campbell River is trying to do, you know, both of these things in our own way, but some of these have more of a regional focus, and especially with recovery, with Sakwa-Luton starting up across the water. You know, that's not really Campbell River's area. I mean, we can talk to them, but this is probably more of a forum to get people talking together about what they're doing, so that we can supply second stage housing for the people that are coming out of that facility, so that we can support them, so that anything that we do in Campbell River in terms of recovery facilities is going to be complementary to what they're doing over there. And I really see that this is possibly a committee that can be focused on that and really make a difference in the short term, because it's stuff that's on the verge of happening, and we can push it over the finish line.
Thank you. Say that again? Yep. So let's vote on the question. All in favor of this report? And are we going to have a motion to have staff bring back a report with some action items? Okay, all in favor?
On receipt?
Yep. Okay, and a motion for staff?
Yeah, I'll make that motion.
Okay. And do you want to let staff know what the motion is, please?
Motion to ask staff to bring back a report on possible priority areas for the health committee over the next, I'm not sure what a time frame would be, maybe a year and a half or something like that.
Quickly. Seconder?
Second.
Thank you. All in favor? And that carries. Moving on to item 3. This is the 2025 schedule of the committee meetings for receipt. If I can have a motion for that, please.
Move A.
Can I get a seconder?
Second.
Okay, all in favor? Did we all look at that schedule?
I don't think we have it.
Okay.
I couldn't access the online things without a password.
Well, I only saw 3 other meetings, I think, when I glanced at it quickly.
The only thing that's included in your package is the closed session stuff. The open session, you would have been able to access through the SRD website.
I couldn't access it without a password.
Okay, there should be no password. However, we can bring it up here for you guys to look at.
Yep.
So we're looking at meetings being held on, can you go back, Betty? June 23rd at 10 a.m. October 27th at 10 a.m. and November 24 at 10 a.m.
So those are all Mondays, just for, It should be close to always the fourth Monday, yeah.
Yep. Any concerns with those dates?
Through the chair, I did get regrets from Donna Desmet for being here today. She also shared with me that her availability on Mondays is less than ideal.
Okay. Go ahead.
I won't be at any meetings that are on Mondays. I haven't been to one in 6.5 years, and my schedule won't be changing up.
Okay. So would we like to schedule them for another day other than Monday?
Through the chair, we have a list of options, just one moment. So Thursdays were the second best option. However, we know there is solid waste committee on Thursdays as well as hospital board. So options for June were Thursday, June 19th or June 26th.
Right, and so June 19th, there's a potential overlap with solid waste, and Thursday, June 26th, there's a potential overlap with the hospital board, so I'm not sure who sits on those committees.
Both of us. Are we talking about this meeting being in the afternoon on Thursday, or?
It could be 10 till 12 or 12 till 2 on those Thursdays.
They're usually scheduled till 12:30. At 9:30.
Is there any availability for midweek, like a Wednesday?
Through the chair at the last meeting, Wednesdays were indicated as not ideal.
Okay. How about Tuesdays?
In the recurring options, there are Tuesdays. Unfortunately, just because we're pretty much already at June Tuesdays weren't ideal.
Yep.
But the third Tuesday in September was an option from 12 to 2, September 16th,
Yep.
as well as the third and fourth Thursday at either in the morning or the afternoon. And just rewind back to June, we had the fourth and fifth Monday, the third Thursday, and the fourth Thursday as options. The third Tuesday looks like it doesn't overlap with solid waste or hospital board for September, October, and November. So that would be September 16th, October 21st, and November 18th.
16th looks good.
Well, those dates work for me.
Yeah.
So anybody else?
Are we looking at morning or afternoons for
Afternoon.
At 12. One's not a possibility?
One is a possibility, we just know that historically, some of our members have to leave by 2 o'clock. But if that's not the case now, then
And just to refresh, what day was decided in June?
we have not
Okay.
decided.
Wasn't that June 16th? Weren't we talking about June 16th or what?
September 16th. June 19th overlaps with solid waste.
How do we start at 1?
That's a quick commute.
I can make it. And Ron stays
Yeah.
and does it by Zoom,
So
so
I'll be in town, yeah.
he's already here, I'll drive back.
Thursday,
Yeah,
June.
and I could attend by Zoom too, so that I can get back here in time.
Tuesday in June, it's not listed as an option. The other ones are on Tuesdays. Where's the Tuesday for June? It's not listed on this sheet.
Well, there was a reason. I can't recall right now.
So it appears as though we were looking at Tuesdays for the remaining meetings for the year, notwithstanding June. So I'm just wondering if there
I'm on
was
vacation.
the whole time? The whole month?
No, just Tuesday.
That one Tuesday?
That one Tuesday, third Tuesday, June.
Okay, how about this? We'll put the fourth Tuesday. The rest of these are,
What, June 17th, that's a Tuesday, right?
it's fine, you don't have to be here.
Sure.
Will the council
Yep.
meeting that day?
Be a cow.
You have a Just Like Home Lodge meeting on that day too.
So which day is working for everybody in June?
That would be the third Tuesday again, so we'll be looking at ongoing third Tuesday at 1 p.m.
So
Right now,
we're going to go with the
they're
19th at
canceled,
1?
But mine is, my calendar's screwed.
17th of June.
17th? Okay, that works.
Madison, can you see the city's calendar? Do we have a committee of the whole that day?
It's not until the 24th.
Don't think calendar is. Yes, we should.
Well, 17th looks good.
Should be June the 3rd, June 17th.
Mine says June 24th for the cow.
That would be 3 weeks.
I don't know.
Nothing on June 17th.
Perfect.
Committee of the Whole is June 24th.
24th. So what time was that going to be at? Mornings?
1 o'clock.
1 o'clock?
1 PM?
Okay.
Okay, I think we've landed on the dates. Are we all good with that? Can I get a motion to receive those dates, please? And a seconder? Thank you. All in favor? Moving on. New business, roundtable. So we'll start with Councillor Kerr and we'll work around the table.
Well, actually, I think I said everything that during the previous discussions. Sorry, I've got. You know, my big focus is to both get some changes with housing and with recovery facilities, and that's going to be, you're going to hear that a lot from me. Those are my two major focuses. I think we can, in terms of making some change in this community, I think those two things are top of my list.
Okay. Go ahead.
Well, top of my list would be housing for seniors and non-market housing. I'm not very interested in support of social housing. I think social agencies already have the support of BC Housing and BC Builds. And I know of things like the senior center at the corner of Ironwood and 16th. It needs people pushing to see that complex get going. It's a huge piece of property being held up by basically the cabins are duplexes basically, and each one is half full. So full on one side. The other 4 cabins have already been taken down. They got cabins sitting empty. So for me, a priority would be to get those other portions of the cabins emptied and get that project going. It seems insane to me that we're holding up 240 plus senior housing units for 2. And I know in 2019, BC Housing said that they wouldn't encourage people to move because they were their homes, but when it's almost empty, it seems ridiculous to leave people there when there's other locations next door that they could move into. Those places are operated by River City Inclusion. River City Inclusion has the ability to move them into other units to free up the space. So that's one. And then non-market housing would be the second one. I'm not talking about low income. I'm talking about supporting people that make lower incomes, waitresses, cooks, people working in hospitality, seasonal workers that don't get any support from anyone else. Those are 2 areas that no one's paying attention to. And I think it's been far too long. So those are the 2 places that I would like to see our focus.
I just want to thank everybody for welcoming and inviting me to this committee. I'm sure I'll have much more to offer as I just kind of observe in the first time around. I appreciate the priorities suggested and align with all of them. I think a rent geared to income housing is missed in this community, which would speak to the demographic that Mayor Dahl is speaking about. And I love the idea of recovery services complementing what is up and coming in our neighboring communities. So I think a complement and a continuum of that type of care would be a great resource and asset to our communities and region at large. Thank you.
Thank you.
Yeah, I don't think I have anything further to add at this point. I can get behind all of those things that have been mentioned. I think they're all existing gaps in our community, and happy to have more discussion about it.
Okay, thank you. Go ahead on this side.
Thank you for having me and welcoming me to the committee as well. I work for the Campbell River and District Division of Family Practice. I'm the executive director, work with all the family physicians locally in town. And so I think everything that's been mentioned also 100% I could get behind around housing. One focus that we've been sort of looking at is obviously healthcare workers and the limited housing available, but with is it Just Like Home? I know there was a couple of names. That's been, that's a really exciting initiative that's happening to help attract healthcare workers. I think, again, like Mayor Dahl talked about, housing for seniors and even maybe one step further with long-term care facilities. That facility was supposed to be kind of going and happening possibly 2026, and now I think it's now been pushed to 2028. So that's a concern, I think, locally for where we're at with our wait list for long-term care, which we manage with the division around providing physician what we call MRP for these residents that go to live in long-term care. So we can have 155 new facility, but if we don't have physicians to be MRP for those, it's going to be empty. So yeah, all housing, long-term care would be sort of.
Okay,
Correct,
thank you.
yeah.
And just my comments, I would agree that housing and treatment centers I think that has been something that has plagued this area for so long, and what is being done that's actually constructive. So it'd be nice to see something happen. Thank you. So moving on, we're going to move into closed session. Can I get a motion to receive the report from the Chief Administration Officer? Seconder? And can I get somebody to read out the item B there for, calling the question, all in favor? Thank you. If I can get somebody to read out item B.
I'll move that a closed meeting be held following the public meeting to consider matters deemed to fall within the parameters of subsection 91A, N, and O of the community charter.
Seconder? Thank you. We'll move in camera.